I'm sure most people haven't heard of this post, so it's very unique.
The NMCOSKI is changing, and our course is changing too. From this summer, the NMCOSKI is going to be 10 stations, and we've got 10 rooms to match. Practice every station in our state-of-the-art Central London Training Centre, or connect with the centre through VR from wherever you are in the world. 10 stations, 10 rooms. Yes, the number you need is 0203 637 6722. That's 0203 637 6722. To your success.
Hello, my name is May. I'm a TAVI nurse specialist in one of the trusts here in London. So the TAVI stands for Transcatheter Aortic Valve Implantation.
What did you say? Man knows best.
Here in the UK 2014, so nag-start ako sa elderly ward. So I was there for a year and a half. And then I thought to myself, I have to move. I can't just stay there. So I have to grow. So I found an opening sa cath lab, cardiac cath lab. I was there for 2016 up to 2021 actually. So I only just started in my new trust now as a valve nurse specialist last year, August.
Man knows best.
So basically, we offer this procedure for elderly patients who have severe narrowing of the aortic valve. So therefore, they are patients who present with heart failure symptoms. So you mean mga shortness of breath, mga edema, low exercise tolerance. So we receive referrals from all over the place really. So normally GPs, and we also receive referrals from 4 major hospitals in our catchment area. So it's quite a busy service. There's only 2 of us specialist nurses who handle all of these referrals. Once we receive the referral, we screen the patient. So we see the data that we were given, the clinical information. And then when we see that, okay, this patient can be a candidate for the TAVI, then we book them in to first see the cardiologist in clinic. While they're waiting for that, we also book them for an echo and then potentially a CT scan to look at the valve and the femoral arteries because doon namin ginagawa through the femoral arteries yung procedure. So it doesn't involve open heart surgery. So actually, patients are more keen to have this procedure kasi alam nila na less invasive, therefore less risks involved and also quicker recovery time. So actually, for our healthier patients, yung walang masyadong comorbidities, the next day pwede na silang umuwi. So kung okay yung social nila, like they have family members at home who can support them, they're very surprised na okay, kinabukasan pwede na pala kaming umuwi. That's very good. Unlike open heart surgery, of course, it takes minimum maybe 5 days in hospital. But for us, it's an overnight stay sometimes, just 2 nights on average. And we also follow up the patient. So as nurse specialists, we do the follow-up about 5 to 6 weeks. It's only through telephone call. And then with that conversation, if we feel the patient needs to be seen again in person in clinic or needs to be sent for more tests or we're worried about something, then we can make that decision with that phone call. We try to see the patients from the time we get referred up to the actual procedure within 18 weeks. So there's 18-week pathway that we follow.
Man knows best.
So pros, of course, it's an office hour job. So wala kang nights, bank holidays mo, off ka. Of course, you have more time with your family. And I think depende sa trust mo. I'm quite fortunate na sobrang flexible ng trust ko and ng manager ko, especially with childcare. I have a fixed day off as well. Tapos, for example, as long as matapos ko yung trabaho ko kasi it's very autonomous. So, handle mo yung sarili mong trabaho. As long as tapusin mo yung trabaho mo for the day, if you're happy with what you've accomplished that day, pwede ka umuwi. So, as long as ma-meet mo yung hours mo for the week. So, I think that's the biggest pro. In terms of pay, so I think actually, yung walang enhancements. I used to do on-call, so medyo nami-miss ko yun kasi wala yung additional money sa on-call and sa nights. Pero I think, yun nga, mas maganda yung work-life balance. So, ikaw, up to you kung ano yung mas importante para sa'yo, especially if you have children. And also, very clinical yung job. So, it's a mix of management and clinical. So, it's not more of one or the other. So magandang balance yun kung if you don't want to completely turn yourself away from being clinical, then you'll definitely still be able to use your assessment skills, yung pagkakalate mo, pagbibig mo ng patients, you can still use that. Also with management, you closely liaise with doctors. So mafe-feel mo talaga na, medyo senior na yung role ko. So if you're after that, then definitely it's a good post to learn from when you're after that kind of experience. Yung cons, I think, yung enhancements wala, and also medyo mabigat yung responsibility. So if you're someone na, especially if you're new to this kind of role na ang dami mong responsibilities and you're not able to organize completely kung departmentalist ko anong kailangan mong gawin, then yun yung medyo baka mag-crumble ka at first. Pero I'm sure anyone can adapt to this kind of job if you just take the time to learn and also take criticism from others. Yep.
Manong knows best.
Anyone na punta dito sa UK, they want to grow, diba? Hindi lang natin. So I think the advice I can give you, could give anyone na gusto maging nurse practitioner is to take the leap. So never take na, medyo mabigat yung role na yun, parang hindi ko yata kaya. Just go for it, just apply. You never know if you never try. And then also, if you set your eyes on one particular job that you want to achieve, make sure that every step that you take will be towards that post, hindi yung mga irrelevant. So I think yun, para hindi din masayang yung mga skills mo na tinitake or mga courses mo, I think. So just take the leap and have courage in applying for jobs na, especially this one na never mo pang, I'm sure most people haven't heard of this post, so it's very unique.